All right, you're good.
Okay, so this week I did the metacarpal stress fracture in an intercollegiate rower because I've really taken like an interest in doing different non-traditional athletes. I mean, I guess this isn't really a non-traditional, but it's not something that we see commonly. So it kind of starts off by saying like rowing both in water as competitive sport and on land as an aerobic activity carries like over like risks of overuse injury. So the rowing motion begins with the catch as the oar hits the water, and then the back, hips, and knees are flexed. During the drive, the legs extend while hips and back assume a less flexed position. And then the stroke finishes with flexion of the arms and a straightened back, and the oar is then feathered as it is moved in positions parallel to the water, allowing for recovery for ensuring strokes. Feathering is performed by the inside hand closest to the rigger and serves to reduce wind resistance and avoid waves in rough water. The back, knees, ribs, clavicle, forearms, and wrists have been recognized as vulnerable to injury and associated with these maneuvers. So I kind of wanted to that's in the article, but I wanted that as background because not a lot of us know the mechanisms of rowing. So I wanted that in there first to kind of bring it up. And then newer oar designs with larger blades have further increased the musculoskeletal stress per rowing. So this is about a healthy 18-year-old female rower in late season. She went to the clinic and had a 3-week history of a non-dominant right hand pain without any trauma to cause it. And so it was chronic, clearly. She was a starboard side oarswoman and generally in the 3 or 5 seat of the 8-woman shell. So that kind of explains where she's sitting. Her symptoms began near the conclusion of her first season, so at the end, which makes sense if it was chronic. It wouldn't. I mean, it would be near the end or more the middle. Um, of competitive rowing as she prepared for conference championships. The pain was worse with activity and ultimately limited her ability to row. The involved hand was her non-feathering hand, power hand. By physical examination, she had swelling in the area of the fourth metacarpal phalangeal joint. There was no ecchymosis, mass, or deformity noted. She was tender to palpate on the distal fourth metacarpal. She had full painless range of motion of the wrist and fingers, but experienced pain on resisted extension of the fourth finger. A diagnosis of the metacarpal stress fracture was made. She was treated with a reduced training regimen. Her symptoms did not resolve until after the season was over. After 6 weeks from rowing, and then she returned to competitive rowing 4 months later and was uneventful, and she continues to participate nearly 1 year to her injury without any symptoms. So the frustrating part about this was, so she was treated clearly with a reduced training regimen, and it kind of talks about how a year later, her symptoms are gone. So it's particularity of this case. This I don't know how to say this. Tennis-related metacarpal injury is the absence of an impaction mechanism, which is what they found interesting. It's kind of frustrating in this because they don't really tell you what treatment, but I'll talk about that later. Besides the rest, and it was hard. So it was hard to compare to this to any other treatment because they didn't really talk about a treatment plan except rest. Because they talked about how this is the first one ever documented, which I don't think is true. I think this is just the first one they ever reported. So which I believe rest was correct thing to do, but I don't know if they used a certain method of treatment for her to compare to others if data did arise, since they don't show it. And then rowing both in water as a competitive sport and land as an aerobic activity carries with risks of overuse injuries, clearly. The rowing motion, it kind of explains it begins with the catch that the oar hits the water and the back, hips, and knees are flexed. And then during the drive, the legs extend, like I said earlier, and the stroke finishes with the flexion of the arms and a straightened back. And the oar is feathered. It kind of talks about all of that. I think that it's interesting report because I've been more drawn, like I said, to the non-traditional athletes. And this is a rare case about a rower. I do think there is probably more reports of having metacarpal stress fractures than they report, and I also think that they should have reported the treatment that they had used, which I thought was really weird because they only reported that the treatment was rest. Like, they didn't do anything else for it. They didn't try to, like, they didn't talk about the different stages of, like, I mean, they kind of did. They said, like, they tested 4 months later and it was still painful, and then 6 months, or say 6 weeks, no, 4 months later was uneventful, and then, or 6 weeks absence from rowing, she's still hurt. 4 months later was uneventful, and then she a year later participated and symptoms were gone. So they didn't really say like what tests they did to like see if it was or anything. Um, and I find it interesting that there's has been more stress related injuries due to larger blades, and that they still use these blades even though it shows that there's a high rate of injury. And I do think that there probably is more reports of rowers having metacarpal stress fractures than they report. And I also think that they should have reported the treatment, like I was talking about, so that others could use this treatment for their own or grow off of it, so like they can build and have future treatment plans for other people to use. And then I just think it's weird that they called it rare and there's no reports on it, but this is like a mechanism that they use a lot when they're rowing. Like with both hands, they use either like the one that is more has more stress placed than the one that isn't, no matter what. I think, and they said that it's just like how the wood it doesn't have any give.
Yeah.
So that's why they think it has so much stress, is because it doesn't have any give, so your hand just keeps hitting it and hitting it and hitting it. So I thought that was interesting and it made sense. And then I want to know if this was the only reported instance of this injury, and if they were to send out like a survey to other rowers or athletic trainers of rowers, if they would find more data on it. And I find it hard to believe that this is something that's only been found in one rower, especially with the, like I said, like the report of the oar not being so giving. And they said younger athletes that are in rowing, they grip on it harder. So that causes more pain. Whereas if they like when they're older, they kind of already know like to loosen up a little bit. So that's another reason that it's a mechanism injury. And then it puts a funny question in my head because in this document, it talks about how ice cream scoopers can sometimes get this injury. And so I was just wondering, like, what if they did the stats on this and how many of them actually ran into this issue and didn't know what it was?
And
And
I've
then
had in my day, and I've never had this issue.
how much ice cream do you scoop daily?
Other issues kind of around my stomach area, but in my hand.
Whatever. Um, but I don't think this is a case report necessarily like you could use directly towards athletes unless you work with rowers. But I do think it's a good reminder that there are injuries like that we're gonna deal with that we're not gonna know the answer to, and we'll be like kind of the forefront of treatment on it. And it's just a friendly reminder that like we're always gonna be learning something new. Like we'll never know all of the answers. So I thought it was kind of more of like a spin-off of like a life lesson rather than something that I could use daily in a sense.
Yeah, I like it. I mean, I can definitely see how the mechanism with the because while they slice through the water, that's still quite a bit of force being put on that other hand, and the repetitive motion of having to turn that paddle over back and forth would be stressful. I would think on the hand and on the ligamentous and muscle structures around the hand. So I can see how it would be an issue. But
And then there's a picture of it. I believe there's a picture. If it'll let me show you. Bring your shared window. How do I show you the other share? Oh, new share. Hold on. So it's right about there. You can't really see it, but they have the arrow.
oh yeah, I see where it's at.
Yeah.
It just kind of shows the ossification after that has started. All right.
Yeah.
Well, I will show you mine, I guess, if I have to.
Okay.
I'm gonna show you the actual. article first. I wanted you to see the picture. I wanted everybody else to see the picture I showed you earlier, but so it
That
looks like
picture's crazy.
your shoulder, but it's actually an elbow.
Jeez. That's crazy.
And then there's them during the surgery. There's the post surgical external fixation.
It's just whack.
Crazy stuff. Okay.
Mm.
What's crazy? I'll tell you another part of it that's crazy here in a second. Mine's kind of shorter this
You
year.
gotta explain what's happening.
Let me make this less of a pain to look at. There we go. Okay, so this is a 43-year-old woman. So it's a non-traditional patient, but I thought that it was so interesting that I was going to do it anyway. 43-year-old woman with a pretty obvious elbow dislocation, I'd say. Wouldn't you say so?
Yeah. I mean, that's pretty obvious. I would hope no one questioned it.
Yeah. The left arm, whenever she got hurt, she wasn't alone. This is the crazy part. So the way that it describes the story, which I don't know that the way that it kind of lives to, it doesn't necessarily spell it out word for word, but she wasn't alone when this happened. Like they were working a field, her and some other people, and she fell off a tractor and dislocated her elbow and then got back on the tractor basically with that injury. They splinted it and then they came into the trauma unit 5 hours post injury.
5?
5 hours post injury before she went into the trauma unit.
How did she not bleed out and die?
Yeah, my exact same question. Yeah. So 5 hours after the injury, the radial artery was severed, or the brachial artery was severed. Sorry. The artery was severed. They tested that by checking the radial pulse. That's where I got radial from. But she didn't have any nerve damage. Don't know how.
She didn't have any nerve damage. It was just that clean of like.
Yeah. So
Crazy.
she underwent surgery. The elbow was relocated or reduced, and then they sutured the joint capsule back together. And it didn't say in there that they fixed any ligament structures, but I would think that they would have had to have fixed both the UCL and the radial collateral ligament. That is. And then so I would think that those would have to get fixed, but I don't know why they didn't. But they fixed the brachial artery by using the great saphenous vein. So they just extracted that from the area and put it in. And then they did a fasciotomy on the left arm because they were scared that because they wanted to prevent a compartment syndrome, which was highly likely in this situation, obviously.
Yeah, that makes sense.
And then they put on an external fixation device, which you saw in the picture, for 4 weeks. And they referred her to physical therapy. They didn't talk about what the physical therapy was. They just referred her. And 6 months post-operation, so 5 months physical therapy. She had normal range of motion and close to normal strength, and she was released from physical therapy to go back to work. So all in all, it was 6 months, which I thought was pretty good recovery actually for how bad that injury was.
I just can't believe she waited 5 hours.
So 5 hours to go in, 7 hours from injury till the time that surgery started.
That's just crazy. Right.
I was really surprised at how low the number of injury or like blood vessel injuries or artery injuries were with elbow dislocations. It's below 13%. I mean, still something that you definitely need to be worried about, but it's not like every elbow injury or half of elbow injuries or anything like that have artery damage. It's not that common.
Yeah.
But in checking that, you want to feel for the distal radial pulse, look for paleness in the hand. Um, if it's an open dislocation, it's going to need surgical intervention. If not, it needs to be reduced as soon as.
Yeah.
But it's not like this is one of those things that I don't think that you're going to be judged if you don't like a shoulder dislocation. You need to feel confident in doing right. An elbow
Yeah.
dislocation, it's not like I don't think anybody's going to judge us for not being able to reduce an elbow. Like that's something that you can spin on.
Yeah. The one time that I dealt with a dislocated elbow, we had to vacuum splint it. Like we just didn't even mess with it.
Yeah, I, I that's what I would do. Just vacuum splint and send. Unless it was, I mean, if it's something where they don't have a pulse in their hand, it, I mean, you gotta just. I mean, I guess if you know that your response time is good with EMS, then yeah. But if you're somewhere out in the middle of nowhere, then you got to do your best, I guess, to try to fix that. Um, and then it's important in my clinical practice because it talks about emergency treatment for an elbow dislocation, as well as ruling in and out the presence of a venous or arterial injury, which is a possible comorbidity.
Yeah.
Kind of short and sweet this week.
Yeah, mine was shorter this week too, so I understand.
But yeah, I thought it was interesting, and I know that it's not necessarily something that we're going to see commonly, and even less because it's a 43-year-old woman. But it's, I mean, it's
But
something
hey,
to prepare for.
it's still crazy.
Yeah.
Still crazy.
So, like I
Little
said,
guy.
I don't know if they fixed the UCL or RCL. Um, so,
Hmm.
so here, I'll stop recording now.